Yo, what's up, everybody? Welcome to another podcast, Biohacks Podcast with Dr. D. So last time we spoke a lot about cholesterol and your heart health and the skinny and the truth about cholesterol and does it clog your arteries? What's the big deal with cholesterol and how really plaque is built up in your heart? So the thing is, when we're thinking about cholesterol, we're worried about plaque, right? That's what we spoke about last time. So why don't we just look inside the arteries, actually see what it really looks like inside those arteries? And that's where we have these new amazing exams like Cleerly Health, which is great. It's this AI CT angiography, which is phenomenal to see what's really going on inside your arteries. So instead of just looking at blood work, one silly PDF that tells you cholesterol, LDL, HDL, and if you're lucky, VLDL, why don't we go even deeper, see with the quality of plaque that you have, if it's calcified plaque, soft plaque, or soft and inflamed plaque. And we also kind of demystify the whole thing with calcium scores, how you can have a calcium score of 0, but in actuality have a lot of plaque in there. And the plaque that we're most worried about is, yes, the soft plaque, but even more so the soft and inflamed plaque. So calcium scores, kind of old. Clearly, artificial intelligence, the newest and the greatest stuff. And then once you have that plaque information, once you actually have the diameter and the quality of the plaque information, or the size of the plaque and the quality of the plaque, then that's when you could look at things like oxidative markers, toxins, environmental toxins, et cetera, that we were talking about last time, that will tell you more about that plaque. And we could look at things like specific genetic markers and other markers that will influence atherosclerosis, or the ability for you to form plaque. And that's how you really should assess, in my humble opinion, the atherogenesis, how well, or it's kind of not well, but how you are forming plaque, because plaque is a big problem, and plaque is the #1 killer in the developed world. But here's the thing. Every time I say it's the #1 killer, I'm just quoting statistics and mainstream stats out there. But to tell you the truth, it's not the plaque, it's toxins. So toxins are the biggest problem. Toxins are causing huge issues at the level of cancer, at the level of autoimmune disease, but also at the level of atherogenesis, creating plaque. So that's where you're going to have issues that will affect all your vessels, which we spoke about, your major vessels last time, your coronaries, carotids, popliteals, iliacs, aorta. But then you have also these small vessels in your brain, which the tips of them get clogged up. And that's when you have something called small vessel disease into your latter years of life, and you're having plaque in the small vessels of your brain. And guess what? You're not having proper tissue perfusion into your brain. And then what's going to happen? You're not going to think straight. You're going to start to have cognitive issues. You don't want that, right? And that's, guys, where I also recommend that you do certain tests. There's an amazing test that you do on an MRI called the NeuroQuant, where you look at specific areas of your brain, or kind of little organs. Your brain has, it was so crazy for me the first time I learned this, because I don't know, when I was in med school, I don't know, I thought the brain was just like a big brain. I don't know, just a big like brick that was like, I don't know, that could think. But then all of a sudden they start telling me, okay, this is the thalamus, the hypothalamus, the pituitary, the putamen, the globus pallidus, the substantia nigra pars compacta. I'm like, what is all this? And then there's like this fluid system in there, these aqueducts, and the Sylvius aqueduct and Magendie, and all these like crazy, like it's like its own little world. And then there's a tracts and so forth. So your brain is this really, really interesting place. And nobody talks about the neuroanatomy, right? This is basically neuroanatomy, which is huge. I didn't realize that neuroanatomy was going to be that hard and heavy. That's why I had a hard time with it, to tell you the truth. God bless you all neurologists out there, neurosurgeons. But then once I got a better grasp on it, I was like, wow, this is a whole ecosystem in and of itself. But the thing is, it's so dependent on, your brain likes cholesterol, but it's also dependent on not acquiring plaque. Because if you get plaque in your brain, your decreasing your cognitive power. And that's where I like this neuroquant test for multiple reasons. You can actually see how developed certain areas are as you age and why certain areas are underdeveloping. And that's where you can get into, but that's a whole different conversation, podcast for another time, about cognitive function and improving brain health, right? But one of the first conversation, especially if you're in your latter decades of your life, I always talk to people about, like, how is your brain circulation looking like? So your circulatory system is very important. So today I want to talk about some interventions that you can use to help mitigate the formation of plaque. Okay. Guys, it's no secret anymore that many docs, especially in our field, functional medicine, holistic, et cetera, not a big fan of statins. And you start to see this growing more and more. And if you just look at how the statistics are reported on statins, and I touched base a little bit on this, and it's a really nebulous topic. It's to tell you the truth, I consider myself someone that can explain complex medical principles using, being jokeful, allegorical, etc., to make it easy. But this one, actually, I'm like, it makes me scratch my head twice to be like, okay, how do I explain this one? So, but the statistics on this thing, when talking about statins, they report statins a little differently than sometimes they report many other things. So they report it based off something called the relative risk reduction, not absolute risk reduction, right? So they're not really looking at the total delta that's being affected. It's like they isolate, if there's 100 people, they make the delta, the number of people, a lot smaller, and then only report that. Okay. So statins, they don't really provide a big benefit. And then when you start looking at these people that have been on statins for 30 years, still having heart attacks, et cetera, atherosclerosis is not a problem that we have solved. And I know, if there's cardiologists listening here, and especially traditional, it's not. It's really not. It's not a solved problem. Oh, the heart attack rates are decreasing, et cetera. But it's still, we still have a big issue with this thing. And it's like, oh, we're doing better and so forth, but we're not. We're not, guys. It's like, and we really need to wake up, because it's, look, our budget for the health systems of this country is the bigger than the Department of Defense. It's crazy. The amount that we're spending in health is huge. It's sixth global economy. We spend a lot on health. We didn't spend on chronic care years ago. And we're spending tons during when JFK was president. We spent zero on chronic disease. Now we spend tons, $4.3 trillion a year. It's a lot of money. And we're the worst at health. We're doing bad. When you look at countries, when there's not that many industrial new technologies and things of the sort, they're doing better than us. Like, if you look at these people, the more isolated they are, like the Indians in the middle, that still live in the middle of the jungles and so forth, they don't have these issues that we have. These are not modern day diseases. These are technologies that we've been seduced to use, and they're causing issues. So I really caution any cardiologists or doctors listening to this to just really keep on clinging to our old systems, because they are not working. They're not working. And if you're a patient and you're going to doctors that are still, just looking at those, one or two markers, and here, take your statin. No, that's wrong. It's time for innovation. It's time to look at nutrition. It's time to look at big data on humans, instead of just looking at a couple of numbers and prescribing statins. That's not the way it's supposed to go. And we have better drugs now that have come out, like the PCSK9 inhibitors, like Repatha, for example. It's better, but it's still not. It's not addressing the whole recipe for plaque. And that's where sometimes I get a little frustrated with doctors, even in our area, where it's like, okay, just put them on a Repatha and they're fine. It's like, no. And then there's even other ones coming out, or that have come out, like inclisiran, which is also a PCSK9 inhibitor, but works at the level of mRNA. We don't use that. And the thing is, it's convenient because it's an injection, from what I understand, every 6 months. So it's very convenient. But the thing is, that should be really, 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 really last recourse, and for somebody that's really in a danger zone. So somebody that did their Cleerly and it's like, whoa, this is a problem, etc. Or someone's that has had heart attacks, etc. Like the number one risk factor for having a heart attack is having a prior a prior heart attack, right? So that's really important when we're considering these things. So yes, there is in my opinion, a tiny place for some of these newer drugs. In my opinion, there's like very, 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 very. I mean, it has to be a super nuanced situation. I can't even say like on the statin thing. Really, that thing doesn't work. And even for people that have had heart attacks, there's studies showing that it only extends lifespan by 4 days. So it's really it's a stinky medication. I really don't think it's wonderful at all. But now, there are other things. For example, phosphatidylcholine. Phosphatidylcholine is found inside your body. Wonderful. It's found in the phospholipid bilayer of the cell wall. So cell walls use it. I mean, it's found all over your body. All cells have it, use it, phosphatidylcholine. It's also found in your gallbladder. So if your gallbladder doesn't have phosphatidylcholine, check this out, you're going to have a tendency to form cholesterol gallstones, okay? So you'll literally start to form stones of cholesterol inside your gallbladder, okay? Interesting. And then you get cholelithiasis and all that other choledocholithiasis, all that, just basically issues with stones in your gallbladder. But here's the thing. If phosphatidylcholine, okay, or to make it for short, we call it PC, okay, phosphatidylcholine, can emulsify, meaning melt. If it can melt cholesterol stones, well, shouldn't it also be able to melt cholesterol plaque? But Doc, wait a minute, you said cholesterol wasn't the big thing in forming plaque. Yes, there's many, many variables, many, many ingredients in that recipe other than cholesterol, but cholesterol is found in plaque. And the thing is, phosphatidylcholine is really good at emulsifying that plaque. And there's data and there's studies out on this, guys. So I urge you, and I'm sure most of you have not heard of this. And guys, I bet you, if there's 100 doctors listening to this right now, no, I'm not even going to say 100. If there's 1,000 doctors listening to this right now, I'm talking to the non-clinical people. Because you probably think, do doctors know about this? I bet you if there's 1,000, maybe 1 or 2 have heard of this, using phosphatidylcholine in use for plaque. And I'm not trying to down doctors. That is never, ever, 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 ever my goal. On the contrary, I'm like to uplift people, etc. But what I'm saying is it's not mainstream for us. Like, you really have to go out of your way to learn these things, or, like me, be graced, by having somebody in your network. In this case, I was shown this by triple board certified cardiologist from Johns Hopkins that no longer does interventional cardiology and helps people to reverse plaque by using these kinds of therapies. Okay, so. And that's how I've been able to learn it. And to tell you the truth, that's how I learned a lot of stuff, guys. I always cling on to the best of the best in their field. And I become friendly with them. And then, they're so kind to teach me these things. And then at Biohacks, I like to put all of it together, put all the pieces of the puzzle together. So anyways, phosphatidylcholine is phenomenal. Discovered in 1950 in Switzerland. A lot of applications used in plastic surgery as well, etc. Many different kinds of applications for phosphatidylcholine. It's ubiquitous in the body. It's found all over the place. So your body's very friendly with it. So the way to use phosphatidylcholine is through IV. So traditionally, it's about 30 IVs. It's not like 1 or 2 IVs, and you have to do them in sequence. So you don't want to do an IV and then do one in another 2 weeks. No, you usually do them in sequence. Kind of like 2 IVs a week is ideal. And you do this until you get to 30 IVs, and then you retest to see how your body's doing. And the idea is it helps to rejuvenate your endothelium, which is the inner wall of the arteries, but also the glycocalyx, which is kind of like, I don't know, I call it like the slimy layer over the endothelium. Okay, so and then you go on maintenance doses of phosphatidylcholine, but oral, and it looks just like fish oil, but a little darker. You can open the capsule, you'll see it's an oil, and again, it's found inside the human body, and it's not again. Don't think of like of the gallbladder thing. There's no correlation, right? Because I know some of you guys might be thinking, oh my God, I don't have a gallbladder. He mentioned gallbladder. Am I going to get plaque? No, it's not a correlation. Okay, it's just cholesterol. It's found in the gallbladder and helps to emulsify cholesterol gallstones. But that's not the correlation you should make. Oh my God, I don't have a gallbladder. Am I going to have plaque in my arteries? No. That's not how it works. The gallbladder is think of it as like a little closed system. Okay, the phosphatidylcholine in the gallbladder is not participating to emulsify cholesterol plaque in the arteries, if that makes any sense. So two different separate systems. Don't think of it that way. But truth of the matter is, there are many great therapies out there. Phosphatidylcholine is definitely one of my favorite ones. It's not new, but it is. I mean, phosphatidylcholine has existed for a really long time, but it's a newer therapy that is surfacing as a solution for people with atherosclerosis. There's other really great interventions that you could do too. Oh, and one more thing with the phosphatidylcholine. The only issue when you do the IV is it could cause superficial thrombophlebitis or phlebitis, meaning your vein can get hard. So you got to really run it very slow. I've done a few IVs of, I'm actually on IV 19 because I did my Cleerly and I had a little bit of plaque. So I'm on IV 19. I actually have to finish the whole thing. But regardless, I did get phlebitis twice, which was very annoying. I was like, oh my God, I got it feels like a cord. It feels like you have a cord under your skin. So, but that was my fault because nurses walk away and then they're like, Dr. D, don't run the IV fast, okay? We're watching you. I'm like, sure. Why don't you guys go scurry along and do your work? And as soon as they walk out, I just make it go a little faster and I get in trouble. Yeah, I'm probably Biohacks' worst patient, according to our staff. I'm a guinea pig, and then I kind of want to do things my way. But anyhow, so phosphatidylcholine, great. Guys, also, other therapies that are really good, for example, for LDLs, to just maintain lower levels of LDLs, because some of you people do have really high levels. So anything over 300 and so forth is and I know I just got a bunch of doctors twisting their nose, but definitely don't use there's a lot of new studies showing too that there's multiple kinds of LDLs, and LDLs in your body. HDL and LDL, they just take cholesterol to and from your liver. Okay, so the whole thing with LDLs, there's a great molecule called pantethine. Pantethine is a derivative of pantothenic acid, which is vitamin B5, guys. Very natural substance, and actually decreases your cholesterol your LDL pretty well. For those of you that do have issues with oxidized LDL, okay. The thing is, it's not LDL, no, oxidized. You don't want it oxidized. So if you did your LDLs like your ox LDL, you can ask this to your doctor. OXLDL, or even another marker called Plaque. It's literally called Plaque, PLAC. It's an acronym. It stands for something, which I don't recall at the moment right now, but that's also, pantethine is really good for that too. People with LDL little a, even though LDL little a, guys, pantethine has almost everything has a very small effect on LDL little a or lipoprotein A, which I mentioned on the first podcast, which indeed is a bad LDL. So pantethine is something really, really good too. Obviously, guys, you should run your omegas. Omegas are very important. Don't forget your omegas have a TOTOX score, which is total oxidation score, meaning fish oils, they're done, they're put on a shelf, and they just sit there on a shelf. So they go rancid, guys. and then are they really clean, et cetera, and they get oxidized. So you don't want to be using fish oils that are oxidized. That's why they have a total oxidation score, and that's something you should look into to understand the quality of your omegas. So you have EPA and DHA as well, so higher levels, better for your omegas. And if you really want to know if you're using a cheap omega, throw it in the freezer, and then next day go get it. And if it freezes, it actually freezes, so you try to cut the capsule. And if it freezes, it sucks. If it's still oily, it's good. It's a nice little trick. So, and then for, these are some of the basic things that you should be on for maintaining the quality of your endothelium. CoQ10, ubiquinone, and ubiquinol, which is the active form of CoQ10. There's a big debate. Should you use one or the other? I think there's applications for both. So I actually take one of each every day, along with the pantethine, along with the fish oil, along with my maintenance capsules of phosphatidylcholine. So I do take products that support my glycocalyx. And there's a couple of different products out there. So things like arterial, Revasca, Glycocalyx. There's a couple of products out there that are pretty good that I like personally. And the thing is, you should keep track and inventory, number one, of toxicity inside of you. So check environmental toxins that are increasing your likelihood of forming plaque. Toxins are the biggest problem on the list. So you could be taking all these things, but guess what? If you don't have enough glutathione, for example. Remember, your liver's detoxifying you. All the glucuronidation pathways, et cetera, these are all occurring in your liver. So 60% of your detoxification is done in your liver. So, for example, if you have low levels of glutathione, or if you feel like you've been pretty toxic the last few years, haven't paid attention to your diet, alcohol, drugs, whatever it may be, it's good to do a protocol with these things, like with glutathione, and just micronutrients. Micronutrients are super important in order to get the machinery of detoxification working, right? Don't forget, guys, for example, this whole thing that we just had with Tylenol causing autism, et cetera. Why? Because it depletes an enzyme pathway in your liver, NADPQI. And then what happens, basically, you have lack of glutathione. Then your body can't get rid of the time. And then, boom, you have the issues, okay? So understand how toxic you are. Environmental toxins play a huge role in formation, not only of plaque, but a bunch of different things. But for today, for being very specific in regards to speaking about plaque, environmental toxins play a huge role. Anyways, I gave you a couple of points here on keeping the health of your endothelium and glycocalyx, and hopefully abating plaque growth inside your body. Take care of your circulatory system. If you don't take care of your circulatory system, you're going to clog it. It's like a plumbing system. You clog that thing, you're going to have a problem, and a big one. So if you don't want to stroke out, if you don't want to have a heart attack, hopefully in the latter years of your life, hopefully you're not in danger of one right now. And if you feel like you might be because of family history or whatever it may be, go get yourself a Cleerly. Go to their website, go get yourself a Cleerly. But if you don't want any of that stuff to happen, get on the supplementation bandwagon. Talk to a doctor that understands this. Change your diet. Focus on nutrition. And make sure you really take it serious. Because if you're not committed to your health, if you're not committed and put a routine in place, you can literally die sooner because of that. Your routines, if you have a serious health routine where you're going to take your supplements, you're going to start working out, you're going to start doing your cardio or high intensity interval training, you're going to eat right, etc., that routine can save your life. But if you don't put a good routine in place, that could be the path to your destruction. God bless you all. See you on the next podcast.